Medical Billers Day is March 28, 2024, and you're getting a special treat because I am doing a 4-part series on the 4 basics of medical billing. If you haven't checked out part 1, I'll link it above. Please do so. But remember, Medical Billers Day is the 4th Thursday of March every year. So make sure that you honor the billers in your life and you recognize that day. Also, make sure that you check out my website. I'm wearing one of the designs that I have on the site. It says Medical Billing, the lifeline of healthcare claims. And we all know that is so true. But make sure you keep watching today's video, which is part 2, and we'll be talking all about payment posting and rejections. Keep watching. So if all goes well, the insurance company receives the claim, processes it, sends you a payment, you post it, and everything goes well. So that is what we're hoping for when we actually send out our claims, that we have clean claims that actually get paid the first time. Sometimes it doesn't always go like that. They might not even receive it, and that could be because your claim has been rejected. But before we talk about rejection, let's talk about the word adjudication. It sounds big and scary sometimes, but adjudication just means when the insurance company processes the claim. It doesn't necessarily mean that they will have made a payment, but they have processed it. Now back to rejections. If the claim is rejected, the insurance company cannot adjudicate it. They have not processed it, and so you need to do something about that claim. So let me tell you about the 5 statuses that a claim could be in. I also went through these 5 statuses on a video earlier, so if you have not seen that video, I will link it above. But let me go quickly through what the statuses can be. There are 5 statuses, and the first one can be rejected. If a claim is rejected, that means the insurance company has not received it, whether they rejected it or the clearinghouse rejected it. Then the next one is pending. If a claim is pending, basically they have received the claim, but they're working on it. Then the third one is processed. If a claim is processed, that means they have worked through the claim, reviewed it, did whatever they're supposed to do, made whatever decision that they were going to make. Then you have paid. If a claim is paid, that means we got our money. That is what we want, for a claim to be paid. Remember, if a claim is paid, you also want to check and make sure that you're receiving the amount that you were expecting to receive, because not all the time you will receive the amount that you think they're supposed to pay. So there may be a little bit of problem in there. And the last status is denied. If a claim is denied, that means that the payer has received and processed it, but you probably would not receive a payment. I've also did a video on the different types of errors that you could have made, which is the reason why the insurance has denied your claim, and it's a 2-part video, so make sure you check out both of those parts. It gives you some of the most common errors that you could possibly have made why the insurance company denied your claim. I also wanted to mention that I call it payment posting. A lot of billers do. But that doesn't mean that a payment has to be made. We can receive a EOB, a EOP, a RA, a ERA, which I will mention a little bit further down. But that doesn't mean that on those remittance advices that there's an actual payment attached to it. The insurance may have processed it, but they may not have made a payment, and this is for different reasons. One of the reasons could be that it went all to the patient's deductible. So yes, they received it, they reviewed it, and they processed it, but they didn't make any payment because the payment's responsibility is all to the patient. Now, as I mentioned about EOBs, which is explanation of benefits, EOPs, which is explanation of payments, which is mainly given to the patient. And then we have RAs, which is remittance advice, and ERAs, which is electronic remittance advice, which is usually given to the providers. I'll show you some examples up here. So that you can just see how they look. But different payers, RAs, look different. Now, you might be accustomed to seeing Cigna, RA a specific way for your actual specialty or depending on where you live. But all RAs from different payers are different. You just have to know what you are looking for when you are looking at these RAs. You look for certain information like the provider, the patient, the date of service, the allowed amount, how much they paid. There are certain things that you actually look for. And I have a video on remittance advice and electronic remittance advice, so check that out. Now, when you post payments, you can post them manually. You as the biller can actually be the one posting it. Or it can be that your practice management system online has someone posting it for you. So for example, one of the companies that I work for use Athena. And we don't post the payments for Athena. The people at Athena post it. Now, I believe they post it manually, just how I could post it manually, but they do. So you can do it manually, or you can do it where you have electronic remittance advice that automatically go into your practice management system and post them for you. Now, you do have to make sure that you go and look at those postings and make sure that it's correct, because sometimes the computers make errors. Even though we think they're perfect, they do make errors. So you do need to look behind their postings to just make sure that everything was posted correctly. Now, just like with claims, the software that you use will determine how you post the payments. I might use Medisoft and post my payments one way. You might use Lightech and post your payments another way. You just have to make sure that you know the basics of what you're looking for and how to find the information, such as what's the date of service. Well, first, what's the patient's name? What's the date of service? You know, how much is the allowed amount, how much you're putting towards the visit. So you just need to know those things and how your software works. So I can't tell you how to do the payment posting, but there are things that you should be looking for when you're actually manually posting the payments. And if you're manually posting the payments, then here are some tips to make sure that you're doing it efficiently. The first one is to make sure that you do it consistently. You need to make sure that you post payments all the time, every time that they come in. Don't let your payment posting duties stack up and stack up and stack up, because now you're getting an inaccurate reading of what's outstanding and what is paid. Just because you receive a check or they deposit money into your account, you need to make sure that you also reflect that in the patient's account. Then you want to make sure that you are accurate, okay? What is on the RA needs to be what is in the system. Sometimes we go through the RAs so quickly that we kind of miss stuff or we assume stuff, and that can be a problem. So you need to make sure that after you have gone through all the payments that you have, you calculate the total of what you were supposed to put in, and then print a report to make sure that that total matches what the amount of the checks are. So it's just like a checks and balances to make sure that you did not make any errors. You still probably could have made an error here or there because we're human, but you want to try to make sure that you don't make as many errors. Then there's speed. If you are doing hundreds and hundreds of payment posted a week, you want to make sure that you get them done quickly. You don't want to stay too long on doing a set of, RAs. If you have one set of RAs from Cigna and that's taking you 2 weeks to enter, then what about all the other ones that you have to do? So what I would recommend is to make sure that you just do only that, the payment posting, that you're not doing payment posting and then you're calling the insurances when you see a denial and then you get up and you do something else. Try to focus solely on payment posting so that you can get in a groove and have a speed in entering in that information in the system, which will also help you to have less errors and pay attention to detail. Now be sure to watch part 3 of our 4-part series of the 4 basics of medical billing, and I will see you again in my next one.